Hello and welcome back to Pharmacology with Dr. Sokolow. So this is the first module on anticoagulant, antiplatelet, thrombolytic drugs, or more specifically in this module, I'm going to review the physiology and the physiopathology of the coagulation process. So it's important for you to understand the physiology and the pathophysiology in order to understand the mechanism of action of those medications. So first, the big pictures. What are the factors that are important when bleeding occurs to repair a vessel that is bleeding? What are the steps in the coagulation process? So platelets are going to play a major role in the formation of the clot, and we'll move on to the coagulation pathways and see what is going to reinforce that platelet plug. So first, hemostasis is the physiological process by which bleeding is stopped, and the first stage is the formation of that platelet plug. So as you can see here in these figures, you have those platelets that are inactivated. So you see there is no bridges between the platelet, and then if there is some bleeding that is occurring, you have to repair that damaged vessel. And then the platelets are going to be activated by several factors such as collagen, thrombin, platelet activated factor, PAF, ADP, thromboxane A2, and this is going to lead to the activation of their surface receptors. You see the active GP glycoprotein 2B3A receptors, and you're going to have the formation of fibrin bridges between those platelets, fibrinogen bridges between those platelets. So the first step is like the formation of those fibrinogen bridges between the activated receptor on adjacent platelet to create, a platelet plug. And as I mentioned, there are multiple factors that can stimulate those receptors. So keep those in mind, because as we move on into the agent that can modify the platelet aggregation, you would have to know which one act on which of those factors. And then stage 2, this is the coagulation, the production of fibrin to reinforce that platelet plug to make it stronger. So then the hole is, filled with that platelet plug with fibrin. And so the fibrin can be produced by two convergent pathways, the intrinsic coagulation pathways. Intrinsic means within the vascular system. So all the necessary clotting factors are present within the vascular system. An extrinsic coagulation factor, that means comes from outside, and this factor is the thromboplastin, or abbreviated STF, and it's the factor that comes from outside the vascular system and is required for that pathways to work, and both of those pathways are going to converge onto the coagulation factor 10A. And so this consists of a series of cascading reactions that you may have seen in Pathophysiology, and I'm not going to go into the detail of all those different factors activation, but what you have to know is how does that go, what leads to the formation of fibrin. And you see that both of those pathways are optimal for the production of fibrate and the polymerization of fibrin that is going to come and reinforce this platelet clot. And so you see that here you have the extrinsic pathway, so that come from outside the vascular system with thromboplastin, and then you have all the factors that are within the blood vessels and that are important for that coagulation cascade, and that they all converge into that factor 10A. So all those coagulation factors number are in Roman number, so you need to know your number in Roman in order to follow me on this slide. But so you say you have factor 10A, that activates prothrombin, the conversion of prothrombin into thrombin. Then thrombin is going to activate the conversion of fibrinogen into fibrin, and then you have other factors that are going to help with the polymerization of fibrin into that formation of that fibrin plug. And then there are also like factors that are dependent on vitamin K, and we'll see that warfarin, for example, which is an oral anticoagulant, inhibit the synthesis of those factors that are vitamin K dependent because it's a vitamin K antagonist. And those factors are factors 7, 9, 10, and prothrombin. They need vitamin K for their synthesis. Now, why is it important to keep the hemostasis under control? So first, you have a vessel that is bleeding and you have to repair that vessel by the formation of a fibrin clot. But then after, once the repair is done and once the vessel is healing, of course, you want to remove the clot, and so that's when the thrombolytic pathways occur, the thrombolysis occur, and this is to protect the widespread of coagulation. The body must inactivate all those clotting factors that stray from the site of injury and also degrade that fibrin clot once the healing has occurred. And antithrombin is responsible for that inactivation of those coagulation factors so it doesn't go crazy. Now the removal of the clot, so as you see here, you have your fibrin clot, and so this is the thrombolysis, and it's activated by plasmin, and the precursor of plasmin is plasminogen, and fibrin is going to activate the degradation of the fibrin clot into fibrin degradation product. And we'll see when we talk about the thrombolytic or the thrombolytic agent, we will see that they act on these pathways right here. And so you have to be able to distinguish drugs that work on the coagulation factors, drugs that work on the platelet aggregation, and then drugs that work on the thrombolysis. Now, the pathophysiology of coagulation. So thrombosis reflects a pathologic functioning of hemostatic mechanism. So you probably know what a thrombus is, but I have to make sure that you have this understanding, and that it was covered in Pathophys. So it's a clot that is formed within the blood vessel or within the heart, and of course, this is dangerous. And an arterial thrombosis begins with the adhesion of platelet to the arterial wall. Usually you see this in patients who has hypercholesterol, and you have the development of those atherosclerotic plaques, and then you can have around those plaques, you have adhesion of platelet, and that can cause an arterial thrombosis, occlusion of the arteries due to the continued platelet aggregation around there. And then you're going to have narrowing of those arteries, and that is not a good outcome. Now you have venous thrombosis, which result from low blood flow, usually in the legs. So you have low blood flow, and then stagnation of the blood, which initiate the coagulation cascade, and then you can have a formation of a thrombus and a deep venous thrombosis. So this is when it's localized, in the vein. But what can also happen is like you have a piece of that thrombus that is going to break, and then this can go into the lung and cause a pulmonary embolism. And so that this is an emergency situation that need to be treated, and we're going to see which agent can help with the treatment of those different pathology of the coagulation. And so the drugs that are used for the treatment of thromboembolic disorders are the anticoagulants. So these are the drugs that are going to disrupt the coagulation cascade, and then thereby suppressing the production of fibrin. Then you have the antiplatelet, which inhibit the platelet aggregation. And then you have the thrombolytic, which promote the lysis of fibrin and cause the dissolution of thrombi. So make sure that you understand the mechanism of each drug and on which site they are gonna act, because this maybe can be a question on one of your tests. So thank you for listening, and next we're going to move on learning first the anticoagulant medication.